Gosh. Okay, so hello everybody. Second stream of the year, very exciting. 10th stream in total, I think, which is kind of cool. I have a few different papers I wanted to go over tonight that are really interesting. So the first is from JEPM, Journal of Exotic Pet Medicine, and this is talking about, are we providing adequate analgesia for intraosseous infusion in exotic animal practice? So we use intraosseous or IO catheters pretty routinely in exotic animal medicine for patients that either have veins that are too small to place an IV catheter in, or animals where IV access is really challenging due to dehydration or other conditions. So animals arriving in really critical condition, animals in shock, animals with severe hypovolemia. These are all things that kind of preclude having really nice veins. So in larger animals, probably not very difficult to get catheters in emergency situations for very seasoned, experienced staff. But of course, in tiny exotics that, like on a good day, have not great veins because they're so small, we're looking at IO catheters as different options. So when we're placing these in practice, if we have animals who are completely moribund or non-responsive, where not necessarily administering significant anesthesia or analgesia before getting the catheter in, because at this point, getting vascular access is like a do or die situation. But if we are planning it for surgical patients where we know we need vascular access, but we know that their IVs are terrible, or sorry, their veins are terrible, or um, we've tried IV catheters and they're just really not working because the patient's not cooperating. Then we plan a little bit better for IO anesthesia. So these animals, if they're going to be under anesthetic, then that is providing some analgesia. And we have pre-medications on board, usually opioids in combination with other drugs. And then we're also providing some local anesthesia, so local infusions of like lidocaine or bupivacaine. I really like bupivacaine because it gives a little bit more pain management for post placement, depending on the species. That can be like 3 to 6 hours. Um, so we're kind of producing a local block just for that soft tissue, as well as hopefully blocking the periosteum, so the kind of the outside layer of the bone. So this author, who somebody from Tufts, Dr. Charles Cummings, is just kind of reviewing some facts or some data on IO catheter fluid administration, and what he observes. So in some species and some sites, something that's really important to note is that when we're giving these fluids intraosseously, they can be absorbed nearly as rapidly as IV fluids. So IV fluids are preferred compared to like subcutaneous fluids because they're much more rapidly kind of absorbed into the system. They're helping expand the intravascular space if you have a patient who has a volume deficit. And the concern here is that in some species, we can see that IO infusion, because these bones have really good vascularization in these species, we see that IO works just as well. But in other species, fluid absorption can be much slower. So he's specifically referring to this study here, number 3, which is a fluid dynamic study on gopher tortoises comparing IO catheter and venous catheter administration, which that's probably a really cool study. I kind of want to look at that after. It's from 2012. So in colonians, at least, fluid absorption can be much slower. So after 7 minutes, they found that only 50% of the fluids in that study were absorbed. So that's kind of slow. So if we're looking at patients that, reptiles, we generally don't have that very high fluid rates anyway, because their fluid needs tend to be much smaller per unit of body weight compared to other species like birds and small mammals. But if you have these animals at, like a rehydration rate, if you're accounting for a fluid deficit as well as accounting for losses as well, or they're on a surgical fluid rate, which is going to be a little higher than maintenance, then we do need to consider that we could be seeing some volume overload in these IO spaces. Now, in these tortoises, so in tortoises, we tend to use either the bridge, the plastro-carapacial junction between the carapace and the plastron. So there's like a bridge in between the two, and you can like put a catheter in kind of parallel to the body in the bridge. Or in some species that have like a really thick plastron, you can have an IO catheter kind of in the bottom of the plastron, kind of facing cranially. And then, oh gosh, I feel like most Colonian species, it's been a long time since I've treated a turtle at length, just because they're not really present here in Nova Scotia. I don't think the other sites are really effective. So the limbs are really effective if the animal is awake. If you have an anesthetized animal and they can't withdraw into their shell, then you can tentatively use those sites. But I feel like it's just not effective in a turtle or tortoise. You can withdraw their limbs because then they can kind of mess up the catheter. So can we see fluid overload? So that in effect is very painful. So if you have too much fluid in a finite space and it's not being absorbed, then that's absolutely painful. So something important to consider. So they do talk about the need for orthogonal radiographs to confirm placement and perceived pain of placement. I'm not sure why he's talking about needing radiographs to assess the perceived pain of placement. Oh no, that's probably just a separate thought in its entirety. So we need radiographs and they're painful. Okay, that makes more sense. And I mean, orthogonal radiographs, like not really a big deal. We usually have these animals either heavily sedated or again, they're moribund. So, taking radiographs, I find that's not a huge issue when we're placing these catheters. They're talking about the pain of flushing and infusion. And it looks like there is data from human medicine that says that catheter infusion flushing can be really painful. One of the studies here is referring to the Easy IO catheter, which is really cool. I'll actually pull it up. I haven't used this in practice, but they have a video on YouTube here. I'm going to mute this because they talk and they blah, blah, blah. And let's see. Is this the video I'm thinking of? So, no, this isn't the video I'm thinking of. So the video that I've seen is a placement on an awake patient where there's no local anesthesia. And they're like, wow, it didn't hurt at all. And that's just really funny. Yeah, I don't know if this is the one, but anyway, this thing is basically like a tiny cordless drill that places an IO catheter into a bone like a tibia or whatever. So I saw it in a CE lecture on VIN at one point where they were starting to use it a little bit. Oh, it just looks it looks so painful, but apparently it's not, but I don't know. So I saw this in a critical care VIN course at some point. I really don't remember when. And they were talking about using this a little bit in ER with dogs and cats because apparently like it's not that painful. And again, like it's a super interesting tool. I think that, being able to have IO access in larger patients could be really useful. This could be really useful for like bone marrow sampling in large bones in animals. But anyway, I feel like that application is probably not super effective in our exotic patients just because we have really easy ways to get IOs into those patients anyway. So anyway, but really interesting that this study looking at the Easy IO, when the Easy IO people are like, it doesn't hurt, look at how painless it is. But then the study's talking about how maybe the placement's not painful, but flushing and infusion is really painful. So it gives me the GBs. I hope I never have to have an IO catheter. So, okay, yeah, and then they're going over how in this case series of 26 patients, the insertion is not painful, but drug or fluid administration is painful. So again, is that volume expansion? Is that like the pH of the fluid? It's hard to say. So we definitely, want to address pain management with these patients. And again, we tend to have them sedated, so they often have some type of pain management like an opioid on board when we're placing, and we do our best to do a local anesthetic as well. And I find that most of the patients that I've seen who have IO catheters, we're using it for anesthesia, and then we're discontinuing use post-op. I have had some patients in hospital with IO catheters, mostly little reptiles and a few little mammals, who required it for ongoing fluid therapy. So they were really dehydrated, really hypovolemic, and they required that for ongoing fluid maintenance, or sorry, maintenance and deficit fluid administration. And I would say that, we did okay pain management on these animals. I don't think that just thinking back to a few cases that were more recent, like in the past 5 years, I don't think these animals were on like opioids regularly, but they were on some pain management. And then it's really hard to know too, because these animals that we were treating, they were pretty, not quite moribund, but pretty depressed. So quite dull mentation. So then it's harder to assess. I think it's much harder to assess in these patients that pain perception compared to patients that are a little bit more lively. So patients with a much more normal or less depressed mentation. So especially like in reptiles. So I'm thinking of like a couple like small geckos and bearded dragons, a chameleon once. Yeah, definitely like they can be averse to having that catheter touched. Like that's something that I've appreciated, and I think that makes sense. Like kind of jiggling that IO catheter is not something we want to do. We want to make sure that it's supported as much as possible, but we just don't have like really good pain scales for reptiles, and that's because they're so stoic, and they can be very very cryptic with how they express nociception. So that's really frustrating. So so yeah, they're just talking about how like in zoo medicine, zoological, so like any of our weird animal species, the pain of iocatheter placement is emphasized over the pain of infusion. So, and then human evidence or human medicine suggests that it's actually the reverse, that's what we should be paying attention to. So this is just a really cool little like quick review article just saying, hey, maybe we should think about this in a different way. We are, offering pain management for placement, but we really should be continuing that pain management even if the animal doesn't have any other ongoing painful conditions, during infusion or when we continue infusion. So that's really interesting. And of course, compare validated pain scores, blah, 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 blah. Pain scores like grimace scale